In this project, what happens is soldiers come up from Fort Benning, and what they get done right away is they get consented to do research, and then they have their blood drawn. And what we'll be looking at with the blood is precursors and the lipids in the blood that are related to potential PCS, post-concussive syndrome, and post-traumatic stress disorder, PTSD. And so we'll have 3 different types of soldiers that come up, 3 different groups. There'll be some soldiers that have PCS, there'll be some that have PTSD, and there'll be control soldiers. All of these soldiers have been deployed, and then after that what happens, they have their blood drawn, then they go in and have a series of neuropsychological tests which assess their attention, their memory, and how they're feeling that day.
Most fMRI experiments, functional MRI experiments, are task-based. So the subject actually has something to do during the scan. For example, look at pictures or try to regulate their emotions or listen to tones. Resting state MRI is another type of MRI that we also do for all the subjects in this study. And in that scan, you sit in the scanner and you don't think about anything in particular while we scan the brain for about 10 minutes. And it turns out that even though everybody sits in the scanner and thinks about something, there are certain networks that are common to everybody. And those networks can change in response to, say, PCS or post-traumatic stress disorder, or at least that's the hypothesis. So ultimately we're after some sort of objective measure of whether someone has post-concussion syndrome or post-traumatic stress disorder. These are very difficult diseases to diagnose. There are a lot of different factors. If there was something objective, for example, that's at the intersection of neuropsychological testing, imaging, and genetic testing, then that would help in treating these disorders. It would open the door also to studying the efficacy of therapies to see how well they perform over time.
Well, ideally, we'd really like to understand what's taking place when a soldier is concussed, or this to translate to the civilian world too. So when we get a concussion, what changes take place, and what is there specific biomarkers, imaging biomarkers, as well as blood-based biomarkers, which maybe will better assess and diagnose what's happening with the soldier. In addition, we want to be able to predict outcomes and be able to differentiate between overlapping symptoms between PTSD and mild traumatic brain injury. So again, through these research efforts, we'll be able to ideally be able to better diagnose and be able to predict outcomes.